Hi, I'm Dr. Divya Sharma. I'm a sports physiotherapist and I work at Sporting Private Limited. I did my bachelor's in physiotherapy, which is a 4.5 year program. The first 2-3 years are very similar to MBBS, where you learn about human anatomy, you learn about human physiology, you learn about biochemistry and all the things that happen that are basic to the human body. And the final year, obviously, you specialize and you learn a little bit more details about what physiotherapy is about. You have to do a post-graduation to be a sports physiotherapist. So 4.5 year stint in Manipal, and then I came to Delhi. I worked with a few orthopedic doctors who were engaging physiotherapists mainly for helping their patients who had undergone surgery to become, to rehabilitate those patients. I went to UK in 2006, came back to India after getting my MPhil degree in sports biomechanics. Biomechanics is a very upcoming and new field because it talks about how joints respond to muscular forces on the joints. Since I had a background in the human body, it was interesting to know the relationship muscles have to tendons and how movement is produced in the body. The journey after that, it's been 12 years of practice. I started with working with tennis players at Team Tennis Academies. It was a venture of Mahesh Bhupati and a tennis coach in Delhi. What we were doing over there was different than any other physiotherapist had done. So we would not only look at injuries when an athlete got injured, but also look at how to prevent injuries. What could the athlete be doing wrong, which would increase his or her chances of being injured. After 3-4 years of working with them, I also did the same thing with the Indian Golf Union, started working with a whole bunch of golfers, amateurs, professionals. So it has been an interesting journey because when I came back into India, this was a very nascent field. The requirements are, of course, you have to be a science student in +2. You should have a background in biology and physics. You will, then you graduate. As a bachelor in India, there is still scope in hospitals. The hospitals usually prefer, bachelor students because they learn better, and I think it's a good idea to get some work experience as a bachelor's because it makes you realize in which field you need to do your post-graduation. So you could be wanting to do orthopedics, you could be wanting to do neurology. Luckily now there are availability in many good institutions, like Manipal has postgraduate masters for orthopedics, there's sports, there's neurology, and there's pediatrics. And I think now obstetrician and gynecology postgraduate physiotherapists are also coming out. What is the requirements is a 4.5 year bachelor's, a 2-year master's would be ideal. In terms of work experience, obviously 2 to 4 years of work experience really adds and gives you benefit as a clinician. I think in the 10 years ago, a lot of the physiotherapists were using machine-based treatments. Now the trend is changing. So the challenge is that when a patient walks in, they are expecting treatment using machines. So I'm a manual therapist, I hardly use machines. So people are understanding what is the importance of working with somebody who works with muscles, joints, and not only looks at it as pain management. What does one make in terms of money is I think hospitals now, as a starting physiotherapist for 8 hours of work, are paying anywhere between 30 to 40,000 a month. If you are in a private clinic, I think as a bachelor's, similar 30 to 40,000. But if you are a master's, you can expect to be paid anywhere between 50 to 70,000 rupees. I would say that it's always better to gain some work experience, because your chances of earning more increase. In my opinion, I think also collaborating with sports teams, traveling with them increases your chances of being, hired by other sporting bodies like the Sports Authority of India, and then your remuneration can go anywhere between 70,000 to a lakh for a month. I would talk about the scenario, especially in India. When I came back about 10 years ago or 11 years ago, I didn't see so many people being involved in sport. There was a very specific segment of the society that played sport. But now, because people have understood the benefit of being physically fit, a lot more people are running, a lot more people are involving themselves in gymnasiums, and whenever you train hard or whenever you get out of your comfort zone, there is bound to be some injuries. So this is, I think, as a sports physiotherapist, obviously the future is very, very bright. A lot of not only teams expect physiotherapists to work with their athletes, you also have a division in every good hospital as a sports physiotherapist. I would highly recommend that if you have the availability, you finished your bachelor's and you have availability at hand because you're still young, it would be a good idea to do your master's, maybe gain 2-3 years of work experience, and then go specialize more and more into what interests you have. Also, I think it's important to remember that physiotherapy is not only sports. Every person that goes to a workplace, he sits for 8 to 10 hours in front of the computer. Obviously, there is going to be repetitive stress injuries. There can be stress on the neck and shoulders. There can be stress on the lower back. So you always need a physical therapist, not only to alleviate pain, but to help you to understand your body better, to help you to engage better muscles when you're sitting upright, to help you go through exercises which are important, not only to reduce the pain. With your continued work, you are not going to be injured repeatedly. So I think the challenge now would obviously be people working from home. Usually homes are not meant for workstations, so people are using a laptop usually. So a lot more people are complaining of these neck and shoulder and back related injuries. Another scenario is people are used to going to gyms, so they're constantly supervised by trainers. What happens in that is that they are so dependent that the trainer is telling them and cueing them to move better that they forget to do that at home. So a lot of people who are working out from home could increase their chances of injury. There will be a lot more people wanting your help and your expertise. So go out there and try and make a difference to the world.
If you found this video helpful, subscribe to our channel for more career videos every week. Leave your comments on careers you would like to watch, and we will try our best to help you find your stride.